Welcome to Vritti Samvad, Conversations with People Who Inspire, an initiative by Vritti, Thoughts Meet Wellness. Embark on a transformative journey as our host, Dr. D.Ay, engages in a profound conversation with the distinguished Dr. Martina Ziska in the second episode of Vritti Samvad. Renowned as a self-made pioneer in health and Vedic life sciences, Dr. Martina shares her remarkable Ayurvedic voyage. From a diverse educational background to impactful roles in global healthcare, her expertise spans continents. Let's hear from Dr. Martina as she unfolds her Ayurvedic insights, blending ancient wisdom with modern approaches.
Namaskar. In my journey of Ayurveda, I have been really blessed to have come across people from different genres of life who have enriched my life through different ways. Today we are speaking to one such person who has multiple facets to her and who has dabbled into so many different things. I don't even know where to start, I don't even know how to introduce her. But at the end of this talk with her, I'm sure we'll get to know more about Dr. Martina Ziskova. Welcome, Dr. Martina.
Thank you.
How are you today?
I'm good, I'm warm. That means I'm in India.
Yes. So, as I said before, I don't know where to start, I don't know what to say. Let's just start with what is your connection with Ayurveda, because you're a doctor of modern medicine with specialization in neurology. How did this? Now, how is it that a doctor of modern medicine who is specialized in neurology, I know your association with Ayurveda has been for the last 20-25 years, but let me take you to the beginning. What is it that drew you towards Ayurveda?
Well, when I was studying medical school, I had all these questions, which to my mind seemed simple and logical. For example, why children's diseases don't happen at other ages? How is it that when someone has life events, how does that factor into their health? I remember studying psychiatry, and we were told that in my country there is a surge of psychiatric patients coming to be hospitalized when chestnuts are in bloom, which is in May for us, and then when chestnuts are actually making chestnut, the nut, actual
Yes.
nut,
Yes.
which is in the fall.
Yes.
And I asked, why is that? And it was an observational, experiential fact, but no one had an explanation. So when in 1990, as a fresh junior doctor, just finishing medical school and starting the neurology residency, really wandered into a Ayurveda lecture, I heard a system being explained that had all of this factored in. And I felt like I was at home. It was fascinating. And of course I was asking some questions, but the journey in life is never straightforward. So you have to put almost 10 years in between, or 8 years in between, and changing continents and lots of professional searching and changing. And then when the time came to think about how to go further with the professional path, which for me was always more than just a job. It was really calling or service, or I don't want to use the big words, but it was always something really important. Then logically Ayurveda came in place. But at that time I was on the east coast of the US, and there Ayurveda was not practiced. I was in the most traditional state, which was not open. But I felt like I had no choice. So when we put mind into something, or the circumstances forces us, it just has to work.
Yes, it's like you can move mountains if you really decide to, can't you?
Exactly. So that was the beginning of the journey, and as you said, 25 or 20 plus something years later, I'm still finding my way because Ayurveda takes you on a journey of life that has surprise, actually, and maybe even change at various crossroads.
So, let's get into a few technical parts of it. How did you manage to train yourself? Because you said where you first actually realized your calling, you were in a place where there was no training available, or there was no openness towards looking at Ayurveda as a science, or looking at it from the point of view that a career can be made out of it, and more than the career, being able to utilize this knowledge of life to make a difference in other people's lives. So, how is it that you could then zero down to getting the qualification that was required, and what was that journey? Can you share that with us,
I
please?
got a training in the US.
Okay.
So it was a 2-year training. And I always felt for me, I guess having the Western medical education helped.
Okay.
Although, interestingly enough, later on when I became a teacher, I found that in most cases it's actually an obstacle. It might have been that I have been so early into my medical career that I have not had, set up views yet. And so Ayurveda had an easy way to get in. It also might have been that my bent is totally clinical, and Ayurveda fits that bill fantastically. And neurology was changing, and for me, changing countries and continents, going to the US where neurology was technology-based at that time, that was not a good fit. I was missing the clinical part. So I was searching, and there was a room. So I got education in US, but then of course, you have to come to the birthplace.
Yes, absolutely.
But interestingly enough, having a small child and all of that, I waited, I think, more than 5 years to come first time to India. Because what I have seen around other students, they were all going to India immediately just to say they were there. And I felt that's not a good enough reason. So 5 years in my practicing, I went to India, to Pune, for training, and I still learn, I still train. I wonder sometimes, how it would be if I got the traditional BAMS program. But I think on the other hand, you can catch up to a degree. But if you don't have that given knowledge, there's a lots of room for discovering the knowledge yourself.
Yes.
And I have done that in my practice when I was doing Panchakarma from A to Z, everything, being the doctor, being the masseuse, being the cook, the medical, the everything.
Attendant and everything else.
Everything, all the roles except for the patient.
Yes.
I was the 3 in 1.
Yes, yeah.
And I have to say that I have, because it's like being under the microscope with the process, and the patients were staying with me.
Okay.
So I saw them from the morning to the evening, pretty much knew everything about them through that process. I have learned so much when I talk to people who worked at institutions where everyone was doing the different parts.
Jobs.
There were parts of the details I was asking them, and they were saying, we don't know what you're talking about because it belongs to the other person.
Yes.
So everything has advantages and disadvantages.
Yeah.
And this is a cumbersome way to learn. But I guess for me, being a practical, person, a little bit maybe hot-headed when I was younger.
Pitta?
Yeah, definitely. I think I was quick always to apply what I learned, which was good on one hand because there was no hesitation, losing time. But on the other hand, sometimes I think I was a little too gutsy, but I was lucky. Never encounter any problem.
Touch wood.
Yes, touch everything.
It's interesting about how you describe your journey of learning Ayurveda, because when you were describing it to me, I was taken back to how it used to be all those years back when all the Samhitas were written. And it was a student who was with the teacher and constantly observing, questioning, at the same time learning. It wasn't the structured education that we have today. So you kind of are telling me that you learned it almost the old, the Gurukul way, without actually knowing it even.
By default,
By
I would
default,
say.
without, yeah.
And let me take you even a step back.
Yes.
In 1990, when I stumbled onto Ayurveda, it was actually Maharishi Ayurveda.
Okay.
So that summer, I had a luck going to the US with Deepak Chopra Clinic at that time. I got some training there. And then when I came back, we actually trained 100 physicians at my university. There was it was after the political change, there was a huge euphoria. It was the window of unlimited possibilities that clamped up very quickly. By the time I spent on exchange program at the university and with Ayurveda, I added to it back, it was all gone. But some people, family and friends and my colleagues were saying, so you went to America and trained, so share that with us. Especially someone has a problem, so show us how it's taken care of. So I have briefly practiced for about 2 years, not just in hiding actually from my traditional academic career.
Yes.
Ayurveda with no aushadhams,
Okay.
just some ahar vihar, lots of hot water, I remember.
Yes.
And I have seen, honestly, miracles.
Wow.
And that's the power that always stayed with me. That when you touch the right thing, the right place, it's like billiard. All the little pieces or domino, everything just moves one after another. And you just watching, you are observing how the healing power of the body is. We are, after all, only helpers. We are,
Yes.
I mean, Hippocrates said that
Very true.
we are helping, the nature heals. So the intelligence that's there and the system that's in us that knows what to do.
Yes.
It's like if you have a cut, you go sleep at night, you wake up in the morning, it's half better.
Yes.
I was wondering recently about it. It's not like I am telling my finger, do the appropriate thing, do this, do that. It's doing it by itself. It knows how to do it.
That's nature. That's what is
And
happening.
to me, Ayurveda is this science of nature, or what's natural. It's just upholding natural laws.